Bladder cancer is a disease in which malignant cells form in the tissues of the bladder. Smoking can affect the risk of bladder cancer. Signs and symptoms of bladder cancer include blood in the urine and pain during urination. Tests that examine the urine and bladder are used to diagnose bladder cancer. Certain factors affect prognosis and treatment options. The bladder is a hollow organ in the lower part of the abdomen. It is shaped like a small balloon and has a muscular wall that allows it to get larger or smaller to store urine made by the kidneys. There are two kidneys, one on each side of the backbone, above the waist. Tiny tubules in the kidneys filter and clean the blood. They take out waste products and make urine. The urine passes from each kidney through a long tube called a ureter into the bladder. The bladder holds the urine until it passes through the urethra and leaves the body. There are 3 types of bladder cancer that begin in cells in the lining of the bladder. These cancers are named for the type of cells that become malignant. Transitional cell carcinoma, cancer that begins in cells in the innermost tissue layer of the bladder. These cells are able to stretch when the bladder is full and shrink when it is emptied. Most bladder cancers begin in the transitional cells. Squamous cell carcinoma, cancer that begins in squamous cells, thin, flat cells lining the inside of the bladder. Cancer may form after long-term infection or irritation. Adenocarcinoma, cancer that begins in glandular cells that are found in the lining of the bladder. Glandular cells in the bladder make substances such as mucus. This is a very rare type of bladder cancer.